Hey, welcome to the Go to Physio Lumbar series, and this is part 2. And last time we talked a lot about the subjective assessment and looking at clues as to what isn't doing its job. What we're going to do today is we're going to show you a very simple exercise that's extremely powerful. Now, don't let the simplicity of this exercise fool you. A lot of therapists might go to therapist mentorship. I show them this exercise, and this is the thing that they find the most value of, the thing that they can use straight away to get great results with patients. So with that said, let's get straight into the content, and I'll see you on the other side. Okay, so one of the first things that I will do with the patient, if they are mouth breathing, which Pete isn't, but if he was, is I would teach the patient how to nasal breathe, okay, or certainly educate him more on maybe the benefits of nasal breathing, but also getting that tongue in the right position, getting the lips together, and just helping him to restore the ability to nasal breathe. And this is going to be a very important strategy if they have back pain, if they feel like they're getting stressed, which sometimes that could be a predisposition to the back pain or a contributing factor towards that back pain. Then if the athlete has the awareness that any of these signs and symptoms are coming on, then we can use this strategy that I'm going to show Pete to hopefully minimize the reactions. Okay, so what we're going to do is I will usually do this first, then I will get the person a little bit more relaxed, and then I will go into my pain science education or something like that if I felt there was a need to maybe educate the person on what's going on. Okay, so what I would usually do with the person is I would get the person, so Pete, I just want you to pop your tongue on the roof of your mouth slightly behind your teeth, just on that spot there. Again, a little bit beyond the scope of this. Myofunctional therapy, we go into a lot of that in the mentorship, especially in the cervical spine month. Peter, I want you to keep your lips together and I want your teeth slightly apart, okay? And all I want you to do, Peter, is just take a few breaths in and out. Now, as Pete's going to do that for the first time, if he was a mouth breather, he's going to feel a little bit anxious. And I usually like to reassure the patient. I go, Pete, because this is maybe a slightly different way of breathing now than you're used to recently, you might find that you're breathing a little bit faster, might feel a bit strange, you almost might feel a little bit panicky. You may feel panicky. That's okay, that's going to settle down in the next minute or two. Okay, and then as that person starts to settle down and they get used to it, usually that breathing rate will start to decrease. Okay, so we almost contradict ourselves at the start when we get him to nasal breathe. We're trying to slow down his breathing rate, but when he actually does nasal breathe, his respiratory rate increases a little bit initially because he starts to panic a little bit because he's not used to breathing through his nose anymore. He may have developed an altered habit. So once he's kind of calm with that, does it feel a little bit better now? Perfect. Then what we want to do is we want to bring Pete's mind into the present moment. So then what I like to do with the person is, Pete, as you breathe in, I just want you to trace the air as it comes in through your nose and your nostrils, okay? And then I want you to trace that air as it comes down through your throat, into your belly, and then all the way down into the bottom of your belly, okay? And then as you exhale, Pete, I want you just to trace that air as it comes up through the belly, up through the throat, and out through the nose. Now, obviously the air isn't going into the belly, but what I'm looking for there is I want to try to get a bit more of awareness of that diaphragm coming down, okay? And then also that pelvic floor is going to drop as well a little bit at the same time, so we can get maybe a little bit more awareness of the tissues around them, okay? Now, it's very hard to tune into these actual muscles, okay, but we can start to feel all the other tissues around us, like the skin, the fascia, etc., start to mobilize. Okay, so although we mightn't have conscious awareness of the diaphragm and pelvic floor, we'll feel all the other tissues start to move there. Okay, so that's kind of my intention with that. So Pete, trace that air as it comes in through the nose, down through the throat, into the belly, and then exhale, Pete. I want you to trace that air as it comes up through the belly, up through the chest, up through the throat and out through the nose. Are you able to keep your mind on that? Good. And now, Pete, anytime you get back pain or you feel a bit anxious or a little bit worried, that's going to be something that we're going to use. And I just want you to trace the air for 3 breaths, okay? And then what I might do is a little bit more of an advanced technique is, Pete, as you breathe in, okay, and Pete's pretty good at this, okay, because we've been drilling this in for a long time here at the clinic, but for somebody that's in a lot of distress and back pain, this will be quite challenging for them. So what I want you to do now, Pete, is I want you to slow that air down. Okay, so you take 50 to 60, could even be 70, 80% of the air that you were inhaling. So if you're inhaling 100% before, I want you to know just inhale 70%, okay? So just take 30% less air in as you do it, make it nice and light, and slow it down through your nose as you come in. Just slow it down, take a little bit longer to inhale. Trace that air as it comes in through the throat down into the belly, and then I want you to exhale and just slow it down nice and relaxed. What we're trying to do here is we're just trying to alter the respiratory rate, okay? So again, somebody that's in fight or flight, or their sympathetic nervous system is dominant, you're going to see their heart rate usually tends to have less variability. Their breathing rate tends to have less variability. So by slowing that air down, we're giving him some variability in his breathing, okay? We're changing it up. So we're just changing the habits that he's been used to. That's probably contributed a little bit towards this back pain. Okay, good. You okay with that, Pete? And then we would use that strategy, especially then before he goes to sleep as well. So Pete, before you go to bed, I just want you to take 10 breaths, okay? I want you to trace the air for 10 breaths. It's going to be a little bit hard because you're going to find your mind wandering. Every time you find your mind wandering, I just want you to bring it back and bring your attention back on your breath, okay? So again, we're tapping into a little bit of mindfulness here as well, and we're just keeping the person in the present moment, and we're giving them a bit more awareness of his breath. And once he has awareness of his breath, usually what tends to happen subconsciously is that it'll start to change a little bit, it'll start to relax, and then hopefully get a little bit more efficient, okay? So that's a great technique. It's one of the best techniques that I have for back pain, and it's one of the most important, okay? Because that to me is much, much better than teaching Pete to, feel his diaphragm and try consciously recruit through the diaphragm. Whereas if Pete just focuses on the air and slows down the air, things will start to self-organize anyways, okay? So we're not actually teaching Pete to diaphragmatic breathe. All we're doing with Pete is we're bringing his attention to the air, we're slowing it down and we're tracing it and we're feeling it down there. So I'm not telling Pete breathe from here, I'm just telling him trace the air as it comes down, and the more awareness he gets, he naturally tends to revert back to a diaphragmatic breathing strategy. And usually what I'd say to the patient is, Pete, you know how to do this, you will have done this at some point, but you've just lost your way a little bit, you develop new breathing habits, so we just want to remind your brain of a more efficient way to breathe when you're sat at a desk, or when you're watching TV, or even more importantly when you're sleeping, okay? Because there's no need to be breathing through our mouth when we're at rest, when we're sleeping, because there's not a line in the room, we don't need that extra oxygen, okay? So that's one of the best things. The nice thing about that's going to mobilize your diaphragm and pelvic floor. It's going to start mobilizing that rib cage a little bit better, which is going to help us then get better length tension relationships through the transabs, through the obliques, through the rectus abdominis. Okay, so it's a very, very useful strategy. And it's going to be a strategy that we're going to start with, and it's a strategy that I use daily with pretty much every person in pain, and they can use it while they're experiencing pain, or if they feel like they're a little bit worried that the pain's coming on and they're getting a little bit anxious. And they can also use it first thing in the morning and last thing at night. So just before they go to bed, it's a great one to get them out of fight or flight into rest and digest, so better sleep. And then first thing in the morning, if they wake up a little bit stiff, just focusing on that breath, restoring the breath, mobilizing the diaphragm, mobilizing the rib cage, oxygenating all those tissues. There's just so many benefits to it. Okay, so if you learn one thing in the lumbar spine month, get good at coaching that. And that as a pain relief, it's it can be as good as some painkillers, honestly. And a lot of my persistent pain cases, this usually is the best thing. They tell me that I've taught them. Okay, that's one of the best things that I've ever shown them, because it helps their sleep, it helps their diaphragm, it quietens their mind. There's just so many more benefits that's beyond the scope of this lesson. Okay, and then as I said, in the mentorship, we get the tongue involved, we get the floor of the mouth involved, we get the pelvic floor involved as well. But that in itself is brilliant, okay? So give it a try, get used to coaching it, try it yourself as well. And it'll take 5 minutes, but it'll help someone sleep better, and so many more benefits that I would just encourage you to use it with almost every patient that you see. Okay, so there you have it. A simple exercise. Don't be fooled by how simple it is. It's a very powerful exercise. It can change the pain experience like that. You can get your diaphragm moving well. It can help the rib cage to move well. It gets us in the present moment. When you focus on the air as it comes through your nose, you are in the present moment. And that is very, very powerful. There's so many people, they're living in the past, they're worried about the future. A lot of these persistent pain cases, this exercise will change lives. Give it a go yourself. see how challenging it is. If you like this approach, if you want to look at the whole body without getting overwhelmed and be able to design and have the confidence and clarity to design long-lasting treatment plans, head over to www.thegotophysio.com. I've got plenty more resources and tips for you there. Okay, so that's it for this week. What we're going to focus on next week is, or in the next lesson, is I'm going to show you how to progress this, get some movement through these areas and make sense of the objective assessment so that we know where to start with our hands-on and our higher level rehab exercises. I'll see you then.